You are now a Donable agent, and it's time to start recruiting blood donors. Here's a little info to help you get started. You'll be able to access this information as a PDF on the Donable website. As a Donable agent, you're doing your part to support your community blood supply. It's important because there would never be a blood shortage if every eligible donor in the US gave just twice a year. But that doesn't happen. Why? Many say it's because they were never asked. That's why you're here. If you ask 10 people, chances are at least one will say yes. Your goal is to ask as many friends, neighbors, colleagues, and family members as possible using all methods of communication, like personal conversations, texts, calls, emails, and social media posts. So let's talk about some facts you can use to recruit and educate donors. The most important one donation can save up to 3 lives. That'll come in handy when potential donors object to giving. If someone doesn't seem interested, don't stop there. Remind them of these important stats. The average blood transfusion is 3 donations. 1 in 7 people who enter a hospital will need a blood transfusion. 25% of the blood supply is used by cancer patients. 1 car accident victim can need around 100 units. And every 2 seconds, someone in the US needs blood. As you're recruiting, you may get some questions about donor eligibility. You can share some basic info and leave the rest to the amazing blood center staff who will take care of your donors. Blood donors you recruit must be 18 years old. Donors also need to weigh at least 110 pounds. Donors can give whole blood every 56 days. That's the most common donation. Most medications are okay to take and still donate. For example, blood pressure, thyroid, anxiety, and cholesterol meds are all fine. Those taking an antibiotic for an illness or infection, they should wait 7 days from the last dose. Some potential donors may say they don't know their blood type. No problem. After donating, their blood center will issue them a donor card with their blood type. You may have people tell you they don't have enough blood. Well, if people are over 110 pounds, they generally have about 10 to 12 pints of blood in their body. A blood donation is a little less than a pint, and the volume is replaced within 24 hours. The human body is truly amazing. A donor may say they are anemic, but iron levels fluctuate on a daily basis. In fact, donating blood serves as a mini physical to check things like hemoglobin, which is a great perk. What if a donor asks you about their recent travel? Most, but not all, tourist locations are acceptable. The location of the trip is most important due to the threat of malaria and other localized infections and diseases. The center staff will have a list. A donor may say they have diabetes. Both type 1 and type 2 diabetics are eligible to donate, as long as blood sugar levels are stable. Medication for diabetes is also okay. The COVID-19 vaccine is not required to donate, and receiving the vaccine does not affect eligibility. Donors may have to wait up to 2 weeks for certain vaccines, though, like for meningitis. A few more things. There is no age limit for donating blood. Cancer survivors can generally give blood a year after being declared cancer-free, although those who had blood cancers like leukemia or lymphoma are permanently ineligible to donate. And lastly, a common one, donors can give if they have a tattoo or piercing. Once you have some donors signed up, be sure to give them these tips before their donation. The more you tell them, the better their experience will be. First of all, donors need to feel healthy and well on the day of their donation. If they don't, they'll need to wait until their symptoms pass before donating. Tell them to bring a photo ID and eat a nutritionally balanced meal within a couple hours of donating. Lots of protein is best. And hydrate. It's always a good idea to drink a lot of water. Donors will have their pulse, blood pressure, iron level, and temperature checked before they get the green light to donate, a mini physical. A real time-saving tip is answering the medical history questionnaire online the day of the donation, but before arriving at the donation location. The average time spent from beginning to end is about an hour. There's no better way to spend your time than saving lives. The best thing you can do as a donable agent is show gratitude to your donors. Reminding a donor about their appointment and checking in with them before their donation can help ease their nervousness if they have any. They will know you are virtually in their corner. After they donate, a quick thank you goes a long way. Donors you recruit will stay active in your Donable app for 6 months, so it's important to stay in touch with your donors to schedule them again, not too long after their last donation. Again, start with gratitude. Thank the Donor stories will be available to you to encourage donors with real-life examples of lives that were saved because of blood donors. Once you've mastered these recruiting skills, you'll soon build a community of donors in your Donable app who can give every 56 days. Remember, your gratitude and encouragement could turn a one-time donor into a donor for life. As you've learned, we need a lot more of those. Saving lives is really important work. Thank you for being a Donable agent.